Hi, Dr. Hagmeyer here, and one of the most common symptoms that I hear from patients all over the country, all over the world that suffer with thyroid problems is anxiety. So in today's video, I want to help you understand just a little bit more about this connection between anxiety and thyroid, and really some of the most common overlooked and missed causes of thyroid disease and anxiety. And I also want to talk to you about one of the most important thyroid markers that are rarely seen done, and if you had this thyroid marker done, it may explain why you're experiencing anxiety in the first place. Now, it's important to realize that many times anxiety is really not stemming from a problem in the brain directly, but rather secondary to either an undiagnosed thyroid disease, an autoimmune disorder affecting the thyroid gland, a hormonal imbalance, and even a gastrointestinal infection. Now, I'll talk more about this link between gastrointestinal infections and depression and anxiety in my next video, but I do want you to realize that there's a very, very powerful connection, so stay tuned for that video. But here's the thing. Many women have thyroid symptoms, yet they're told that their thyroid is not the problem. And the sad part about this is that for many women who suffer with many of these thyroid-like symptoms, the only thing they've ever had done is a TSH and a T4 test. Now, I just got off the phone just a few moments ago with a woman who's been suffering with thyroid problems for over 14 years. She was taking Synthroid, she was still continuing to suffer with all these symptoms, and it got so bad with her weight gain that she wound up having a lap band surgery. And so there's many people out there today that are just so frustrated with the symptoms, that haven't been able to be managed simply with thyroid medication. And it's because thyroid medication is still missing a big part of why the thyroid's not working in the first place. I always tell people that only 10% of your problem or correcting the thyroid has to do with the actual thyroid medication that you may need. The other 90% is going to be centered around all the things that we've talked about in past videos. But coming back to today's video, many people will go in, their doctor may have looked at a T3 level or hasn't not looked at a T3 level, because if they did, it would become quite clear that the patient that's sitting in front of them complaining of the anxiety and the heart palpitations and all the other inward trembling symptoms obviously wouldn't be missed, okay? It wouldn't be overlooked. And so this pattern is really what we call overconversion, and it's one of the things I see in my practice every day. And one of the things that I want you to understand is really how it happens. So let me give you a little background information really that will just kind of expand on this knowledge here. Now, your thyroid gland is going to make two primary hormones. It's going to make T4 and it's going to make T3. T4 is the inactive thyroid hormone, and T4 really needs to get converted into T3. Now, when you have too much T3, this can cause, again, the anxiety, the sleeping problems, the inward trembling, the shivering, heart palpitations. It can even cause panic attacks. So sadly, these symptoms can be medicated away with medications. You can take beta blockers, and you can take anti-anxiety medications. You can take sleeping pills for better sleep. But again, this doesn't affect or change why you're not converting hormone, or why you're over-converting T4 into T3. Now, normally, if you were to be looking at your thyroid levels, if you had a T3 level, typically your T3 level should be between 90 and 180, and your T4 level should be between 6 and 12. Now, what's important here is that you look beyond T4 levels. Now, if all you do is you really look at just the TSH and a T4, you're going to miss this overconversion pattern every single time, and all of the neurological consequences that go along with having too much T3 in your bloodstream. When you test T3 levels, again, I often find that the T3 is elevated, okay? And that's going to be your indicator for overconversion. So hopefully, if you've ever watched any of my other videos, you're already one step ahead of me, okay? And you're already thinking, well, Dr. Hagmeyer, what's causing this overconversion problem, okay? Now, this pattern that I just described occurs in men and women in a couple of different ways. Sometimes men or women are simply taking too much thyroid hormone, okay? In other cases, it can be caused by a metabolic imbalance such as PCOS or cystic ovaries. It can be caused by insulin resistance. It's often found in diabetics that have poor blood sugar control. It's found in pre-diabetics, and often we can see it in conjunction with chronically elevated insulin levels, okay? I also see it in men who are taking testosterone shots or testosterone supplements. Another common cause of anxiety that again is still related to thyroid problems is an individual who may have an undiagnosed autoimmune disease. And this may be something like Hashimoto's disease, or another type of autoimmune disorder called hyperthyroidism, known as Graves' disease. Okay, very, very important. This is why I recommend that you get your antibodies tested against your thyroid. So if all you've ever had done was a TSH and a T4, I really encourage you to get that T3 tested. I encourage you to get your antibodies tested as well. Now, in both of these conditions, you really can have high levels of T3, which again is this active state of thyroid hormone. And again, this can cause the hair loss, it can cause the anxiety, it can cause the heart palpitations. And so again, very, very important to get checked. Now, in these cases, you don't need more medications for symptoms. What you really need to do is you need to find someone who is going to investigate and just dig just a little bit deeper into why you're feeling the way that you do. If all your doctor is doing is prescribing more and more and more medications for every new symptom that you're experiencing, they really haven't corrected or even truly helped you in identifying what your problem is. Now, if what I've just described is you and you want help, contact my office either today, either by phone, contact us by email. But either way, someone from my office will schedule you some time so that we can talk, we can figure out what needs to be done to help you get control over your life, start feeling good again. If you live out of state or even out of the country, just indicate what time zone you're in, and then we'll find a time that works for us so that we can get on the phone and again, talk about how we can work with you remotely. I'm Dr. Hagmeyer. I hope you enjoyed today's video. Check out my website. You're just going to find just a wealth of information about the thyroid, other chronic health problems that we can help using functional medicine. And remember, in my next video, I'm going to talk more about the brain-gut connection as it relates to depression, anxiety. And so that's a another really just great video we're going to put out there for you. Please watch it. And again, it could be the answer to many, many years of suffering. Well, till next time, take care.